In this video, we will discuss the iridoplasty technique using the Siepser sliding knot. This video was shared by Dr. Filipe Lucatto, from Salvador, Brazil. This patient underwent cataract surgery and required iris hooks during the procedure. Due to the presence of anterior synechii between the iris and the intraocular lens, the pupil remained persistently mid-dilated, causing discomfort and photophobia. Therefore, a new surgery was indicated for synechiolysis and iridoplasty. At the beginning of the surgery, a superior temporal paracentesis is created and, with the aid of a hook, the surgeon releases the synechii on the nasal side. Notice that the paracentesis was not directed toward the center of the eye, but rather toward the iris area where the suture was planned, at 12 o'clock. The same is done for the nasal paracentesis. The surgeon then shifts the eye temporally to create an incision pointing toward the desired iris area for the suture. Next, he releases the synechii on the opposite side. If iris bleeding occurs, viscoelastic can be used to pressurize the eye, and the surgeon should wait 1 to 2 minutes for the bleeding to stabilize. Next, a 10-0 Prolene suture is used to pass through the iris. This technique is preferably performed with curved needles, but it can also be done with the straight Prolene needle. The surgeon enters through the nasal paracentesis, passes through the iris tissue, and then directs the needle toward the contralateral iris at the intended suture point. Using a viscoelastic cannula introduced through the contralateral paracentesis, the surgeon guides the needle exit on the opposite side. After passing the suture, the surgeon performs the modified Siepser technique to create the knot. In this technique, a hook retrieves a temporal Prolene loop through the nasal paracentesis. 2 throws are made, and the suture ends are pulled bilaterally through the paracentesis, allowing the knot to slide into the eye until it cinches the iris bite. The maneuver is repeated 2 more times to ensure a secure knot. At the end of the procedure, the surgeon uses retinal scissors to trim the suture ends. Carbachol is then injected, and the surgeon proceeds with a bimanual irrigation system to keep the anterior chamber stable while removing the viscoelastic, completing the surgery.